Welcome to SB Connect, where we connect to and educate for the world of work. This is Health Professions Week, and today we're going to launch Health Professions Week with the help of Amanda Limon, Program Manager from Reach Out, and her topic today is Emerging Medical Occupations in the Inland Empire. So please welcome Amanda and her presentation today. Thank you, Amanda.
Thank you for the introduction, Michael. So good morning, everyone. My name, as Michael said, is Amanda Limon, and I am a program manager at the Inland Health Professions Coalition. And I'm going to talk to you about the opportunities that we provide our students in health career pathways. All right, but before that, let's talk about Reach Out. So Reach Out is a nonprofit organization, and our mission is to strengthen communities by bringing people together to solve our region's toughest issues. So these issues include breaking barriers to educational achievements, expanding economic opportunities, and creating safe, healthy, and innovative communities. So Reach Out has three main branches. We have our public policy and prevention, our youth, family, and wellness, and our Inland Health Professions Coalition, which is the focus of today, right? Health Professions and Health Professions Week. So the goal of IHPC is to achieve a diverse and community responsive health workforce, work collectively to identify and facilitate solutions to the educational, social, and environmental barriers that students face, and to work towards making a seamless health pathway for high school students. So making it easier for y'all. All right, so we're going to talk a little bit about the need of healthcare professionals in the Inland Empire. So our estimated population is around 4.7 million people, and it's estimated to grow by 5.2 million. I know it says 2020. But you can see, obviously, it's still a lot. You just think of 5.2 and add more. Healthcare workers, our healthcare worker ratio to residents in the IE is currently 1 healthcare worker for 34 people. That's really off. Other counties are much lower than that, or lower than that, I shouldn't say much, are lower than that. So Orange County, the ratio is 1 to 22, Los Angeles County, 1 to 23, and San Diego County, 1 to 24. So again, a significant need here in the IE. So what do we do? Well, here at the Inland Health Professions Coalition, we develop and facilitate healthcare career programs. We create work-based learning opportunities for students, and we develop and strengthen the entire spectrum of healthcare programming. Specifically for middle school students, we have our JUMP and HOSA, which JUMP stands for Junior Up and Coming Medical Professions, and HOSA, Health Occupations Student Association. We also have pathways and academies in different high schools. And again, these are all geared towards healthcare careers and promoting those healthcare careers. And we'll get a little bit more into that as we move along through this presentation. All right, so why choose a healthcare career? Well, there's a lot of reasons to choose a healthcare career. Growth and stability. There is a health profession shortage. It is one of the fastest growing careers, not only in the Inland Empire, not only in California, but in the United States. Careers are available for all education and experience levels. So a lot of times when we think of healthcare careers, we tend to think about, doctors or nurses, but we're going to go today beyond doctors and nurses, talk about different health careers. And you can finish school in as few as 16 weeks. That's a pretty short of amount of time. Competitive earning potential, the ability to make a difference in people's lives, and fast-paced and exciting. I'm going to show you, and this is from the US Bureau of Labor Statistics. And if you see the top careers on here, a lot of them, the ones in red, as you can see, are all healthcare careers. So again, fastest growing career here in the US, and a lot of need for it as well. All right, some myths about healthcare careers that I want to bust for you today. So the first one, only good healthcare careers are doctors, dentists, and nurses. Well, by the end of this presentation, you will not think that. Schools are too expensive. I don't know about you all, but I know for me, when I thought about a career, I thought about how much it was going to cost me, how long I was going to be in school. And those were really big things to weigh on my mind as I, looked for a career or what to study. And last, all health professions require a lot of school. And as I said in a previous slide, you could finish school as quick as 16 weeks. So that's false. All right. So our three categories of health careers. So we have medical professionals, which are probably the health careers that you all are more familiar with. Our doctors, our nurses, our dentists. Then we have our allied health professionals and our behavioral health professionals. All right, first up, the one that we all know, medical professionals. So medical professionals are made up of those in general medicine, so all physicians, including nursing, dental, and pharmacy. All right, so a physician, their training takes up to 10 years, if not longer. Again, it depends on your specialty. So you have to do, obviously, finish high school or get your GED. You have to do an undergraduate degree, do 4 years of medical school, and then 2.2 to 5 years of medical education. But there's a high payoff, right? Check out that salary. We have a physician's assistant. This is an individual who's a licensed provider, who is able to diagnose and treat illnesses and disease and prescribe medication for patients. So they're generalists in terms of training. There's 6 years of education in total, so 4 years of undergrad and 2 years of physician assistant school. And their salary, again, pretty competitive. Next, we have our nurse practitioners. So training on the nursing model and concentrate on the impact of diagnosis, testing, and treatment on patients. Their training, they can choose between primary or acute care. They have 6 years of training with 4 years of undergraduate and 2 years of a master's plan. And again, decent salary. All right, registered nurse. So a registered nurse, or an RN, as some of you may know them as, because we like to use the acronym more, is an assistant physician, assistant to a physician, and they provide treatment to patients suffering from various medical conditions. And they're able to administer medication, they monitor patients and their progress, as well as educate their patients and their families on disease prevention and post-hospital treatment. So their training is about 2 to 4 years. They have 2 years of associate, or they can do 4 years of an undergraduate degree, and their salary is between $50,000 and $80,000. All right, a dentist removes decay, fills cavities, repairs, fractured or damaged teeth. They diagnose and treat problems with patients, their teeth, their gums, and related parts of the mouth. They're training 8 years, so they have 4 years of undergraduate school, undergraduate degree, undergraduate school, and then 4 years of dental school, and their salary between $110,000 to $200,000. All right, so a pharmacist. So a pharmacist distributes prescription drugs to individuals. Pharmacists in the community dispense medications, they counsel patients on the use of their prescription medications and over-the-counter medications as well. Their training is 8 years, 4 years of undergrad, and then 4 years of pharmacy school, and their salary between $110,000 to $150,000. All right, so that was our medical professionals. Now we're going to talk about our allied health, non-physician, non-nursing healthcare professionals. All right. So I'm sure some of you have heard of a physical therapist. So a physical therapist helps patients prevent or manage their condition so that they will achieve long-term health benefits. Physical therapists examine each individual and develop a plan using treatment techniques to promote the ability to reduce pain, restore function, and prevent disability. Their training is 6+ years. So they have 4 years of undergraduate, 2 years of a master's, or 4 years to become a doctor. So their salary, $65,000 to $105,000. All right, now we have a physical therapy assistant. So a physical therapy assistant and physical therapist aid the physical therapist, and they work under the direction and supervision of physical therapists. They help patients who are recovering from injuries and illnesses and regain movement and manage pain. So their training is 2 years, and they receive a 2-year associate's degree. And their salary, $40,000 to $65,000. All right, next is our occupational therapists. They treat injured, ill, or disabled patients through the therapeutic use of everyday activities. They help these patients develop, recover, improve, as well as maintain the skills needed for daily living and working. These individuals are very important to the recovery of, for example, people, elder individuals who fall, and maybe they need some help with, as well as physical therapists, but we need some help with therapy and learning the reuse of writing, for example. So they have, their training is 6+ years, 4 years of undergraduate, 2 years of master's for a master's degree, or 3 years for a doctorate. So these individuals can stay at a master's level or go on to receive a doctorate. And their salary is from $60,000 to $90,000. Next, we have our occupational therapy assistants. So much like the physical therapy assistants, they help occupational therapists, and they help the patient develop, recover, and improve, as well as maintain the skills needed for daily living and working. Occupational therapy assistants are directly involved in providing therapy to patients. Occupational therapy aides typically perform supportive activities. So their training is 2 years. Again, similar to the physical therapist assistant, 2 years for an associate's, and their salary ranges from $40,000 to $60,000 a year. Next is our surgical technologist. Surgical technologists are also called in the operating rooms, or operating room technicians, I'm sorry. They assist in surgical operations, so they are in the operating room. They prepare operating rooms, they arrange equipment, they help doctors during surgeries. And their training, similar to the occupational therapist assistant and the physical therapist assistant, 2 years, and their salary is $30,000 to $40,000 a year. All right, our pharmacy technician. Under pharmacist supervision, pharmacy technicians supply medicines to patients, whether on prescription or over the counter. They assemble medicines for prescriptions and provide information to patients and other healthcare professionals. You may see these technicians behind the counter when either you go and get your medications or someone that you know goes and gets their medications. They're there to assist you in, again, explaining and giving you some information about the medications, and probably the ones, again, counting and putting them in the little prescription bottles. Their training, 10 months to 2 years. So a 10-month, they can get a 10-month certificate, or they can get a 2 years associate's degree. And their salary is $20,000 to about $50,000. You can also be an athletic trainer as an allied healthcare professional. So what is an athletic trainer? Well, they're highly qualified, multi-skilled healthcare professionals who collaborate with physicians to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation for injuries and medical conditions. And their training is 4 years, so they can get typically 4 years of an undergraduate degree. Salary, $40,000 to $57,000 a year. All right. Next, we have, excuse me, a medical laboratory technician. So they assist physicians in the diagnosis and treatment of diseases by performing tests on tissue, blood, and other bodily fluids. Medical lab technicians most commonly work in hospitals or doctor's office. So if you've ever had to get your blood drawn or have some type of urinary sample, they're the ones that are looking under the microscope. All right, or running those tests. So training, 2 years, salary $40,000 to $60,000. All right. Our next one is a patient care aide, certified nursing assistant, and licensed vocational nurse. Their training is 2 to 8 weeks, and you can get this training within a 2-week certificate or an 8-month license. Oh, and an 8-month license, I'm sorry. And their salary is between $20,000 and $45,000. And they're similar to a nurse. Although they do have different duties than a registered nurse. As you remember, the registered nurse had to be in school longer, so they have more specialization and more knowledge on certain diseases and conditions. So their scope of practice would be smaller than the registered nurse. Next, we have our dental laboratory technician and dental assistants. So dental laboratory technicians use traditional or digital impressions or molds of a patient's teeth to create crowns, bridges, dentures, and other dental appliances. We also have our dental assistants who perform the tasks. I'm sure you ran into dental assistants if you've ever been to a dentist. So they provide x-rays, record keeping, and they assist the dentist while they clean your teeth. So our training for the laboratory technician and dental assistant is 10 months to 2 years. So we could get a 10-month certificate and a 2 years associate. Salary is between $25,000 and $75,000. All right, so dental hygienists, these individuals clean teeth, they examine patients for signs of oral disease, such as gingivitis, and provide other preventative dental care. Their training is 2 to 4 years. So they have either a 2 years associates or a 4-year undergraduate degree, and their salary is between $50,000 and $90,000. All right, moving on from, and these aren't an exhaustive list of allied healthcare providers. This is just a snapshot, right? I only have about half an hour to deliver all this content to you, so I wanted to get as much as a clear picture of what an allied health professional was as possible. All right, moving right along to our behavioral healthcare professionals. So who are these people? Well, a psychiatrist is a behavioral health professional. Although they also are a medical professional because psychiatrists are MDs, so medical doctors. So a psychiatrist is a medical doctor who specializes in mental health, including substance use disorders. Their training is 12 years. All right. They have 4 years of undergraduate, 4 years of medical school, and then 4 years of graduate medical education. And their salary is $170,000 to $270,000 a year. We also have psychologists, and specifically clinical psychologists assess, diagnose, and treat individuals suffering from psychological distress and mental illness. They also perform psychotherapy and develop treatment plans. So I know a lot of individuals get confused between a psychiatrist and a psychologist. Little trick to remember is that a psychiatrist is a medical doctor. So they had to go to medical school. A psychologist isn't. A psychologist did not go to medical school. But they are, again, equipped to treat a lot of the same problems. The big difference is that psychiatrists are able to provide medication, prescribe medication, and psychologists typically are not. However, there are some states that are allowing psychologists to prescribe medications. But for the most part, the big difference is medical doctor can prescribe meds, psychologists, they can, but that is not always the case. So their training is 8 years, 4 years undergrad and 4 years to receive their doctorate. So 8 years in total, and their salary is between $65,000 and $110,000 a year. All right, so next we have our marriage and family therapists, and these are mental health professionals trained in psychotherapy and family systems. They are licensed to diagnose and treat medical, emotional disorders within the context of marriage, couples, and family systems. Their training is 6 to 8 years. So they can do a 4 years undergraduate or 2 years master's, or they can also receive a doctorate in that should be 4 to 6 years. Yes, 4 to 6 years. So salary is $50,000 to $65,000 a year. And then we have our certified addiction, drug, and alcohol counselor. So these individuals listen to clients, describe their problems and what causes them to engage in addictive behaviors. You'll discuss ways to cope and potentially incorporate methods such as the 12-step program to help clients toward recovery. Their training is 10 months to 2 years, so a 10-month certificate or a 2 years associate's degree. And their salary is between $28,000 and $50,000 a year. And again, this is just a snapshot of the professions under behavioral health. All right, so local schools. So we have some community colleges that have pathways or majors within the healthcare careers. So we have Chaffee Community College, Moreno Valley College, San Jacinto College, Riverside City College, and San Bernardino Valley College. And as I said, these are individuals with a specific program or classes that offer health profession career geared toward classes. And these are all within the IE. All right, so local community colleges, I'm going to skip this because we just kind of went over it, but here are more community colleges within your area. So colleges and universities. So these are 4-year institutions. The other ones were 2-year institutions, or typically 2-year, typically 4-year institutions. So colleges and universities are typically 4-year institutions. So we have Azusa Pacific University, California Baptist University, CSU San Bernardino, Loma Linda University, Western University, the University of California, Riverside, University of Laverne, and the University of Redlands. So we talked a little bit about the cost of college and how we're trying to make it affordable and help students with costs, right? So how can you pay for schools? Well, you can get scholarships. We have here Health Profession Scholarship Finder, excuse me. And this link will take you to scholarships related to the health profession. So there are actually scholarships out there that they want you to get in healthcare career fields. So they'll pay for some portion of your education. We have College Board Scholarship, that's more of a general search, and Fast Web Scholarship Search, which again, a general search. And this isn't exhaustive. These are just a few scholarship portals to help fund your education. Kind of showing you that there are possibilities to get into healthcare careers, and there's a way to, it's affordable. All right, we're also going to talk a little bit about financial aid, Pell Grants, which is free money given to you by the government, or federal loans, not free money, money that you will have to pay back. And you can apply for federal loans through FAFSA. We also have federal work study programs. I did a federal work study program when I was in college, and that's how I paid for part of my education. So they are these jobs within the university, and they're pretty, they aren't extremely difficult jobs. They work around your class schedule, and you are a student worker. So they emphasize the fact that you are a student first and a worker second. So these are really great jobs to help you fund your education. So IHPC also has some programs to help you gear up towards those healthcare career pathways or careers. So we've got work-based learning programs, we've got the block, we've got youth advocates for health access, and our community health worker training program, both a general and apprenticeship. So quickly, a little bit about our work-based learning program is we want to develop awareness. So what careers are out there? So similar to what I did today, going over the careers, putting on a health professions conference, getting you in contact with individuals from a certain health career that you're interested in, exploring jobs, healthcare careers, virtual job shadows and internships, and preparation. So professional trainings, attending conferences, and then training, which is our in-person job shadows and our internships. And you can even get a CPR training and certification. A little bit about the block. So the block is a safe place for youth between the ages of 12 to 21. Services at the block include teen talk sessions on a variety of topics, as well as classes such as first aid training. The youth also receive light snacks and are given referrals to available services throughout the Inland Empire. And we've been open since 2018 and have serviced over 150 youths who have come and visited us. So a little bit more towards your speed, youth are Youth Advocates for Health Access program. So it's a group of young adults who act in the best interest of the community they serve and focus their efforts on equitable community health access. It's a 40-hour training, so 8 hours of class and then 32 hours of field experience. Benefits for engaging in this program or participating in this program, you acquire new skills and strengthen your current skills. You get field practice experience, you have a head start on volunteer hours, and there's even the possibility of a stipend at the completion of the program. Then we have our community health worker program, both the general and the apprenticeship. The general is open to individuals in the community. And this is something further along the line. It's a 3-month training program. We offer class content and in-field experience hours. And our apprenticeship is the 6-month training program, class content and in-field experience hours. The main difference between the general training and the apprenticeship training is that in the apprenticeship training, you're actually already working or have an internship within that field. And we're kind of helping you fine tune and hone your skills. But I know I didn't cover it, so I really wanted to go over what a community health worker is. So a community health worker is a public health worker, and their goal is to connect communities with their healthcare systems and state health departments. They work, it's an umbrella term, and it includes a range of community health aides. So they are typically citizens of a community, and they serve and support the health system as a volunteer or a paid aide. And so that's kind of a little bit about the different careers and different different healthcare career pathways, and the different ways in which Reach Out, IHPC, can help you get there. I kind of went through that quickly, but any questions?
If we have any questions for Amanda, we can take them in the chat box. Any educators? Also, if you have any questions for Amanda, how long has Reach Out been a part of the Inland Empire community?
That is a good question, and I'm drawing a blank right now. The question is, how long has Reach Out been a part of the Inland Empire community, you said?
Yes.
I don't know the exact number, but I know it's definitely more than 50 years.
And what are some suggestions for some of our students participating today across the Inland Empire to connect with Reach Out as an organization? We have high school students participating today.
All right. Well, we can come in here, and here's our social media. If you want to kind of check us out, we have Instagram, Facebook, and YouTube. You can see and learn about all the different programs that we offer. So that's a great way to connect with Reach Out. If you can't be a part of, any of the programs that I talked about, I know specifically the YAHA, the Youth Advocates for Health Access program, is a great program for high school students to become a part of.
And what kind of resources do you have in the high desert community for students in that region?
It depends on what resources you're referring to. So I would have to look specifically and see what resources we have in the high desert, but you can definitely email me and I can follow up with you. And I know it says I info, it should say info@wereachout.org. Or you can email me directly and I can find out what specific resources we have out in the high desert area.
And I don't know, Mr. Barr, do we have a question there?
Oh. Yeah, no, she was asking what the Inland Empire consisted, if it was Victorville and what areas.
So yes, absolutely. And I like to see everyone's faces. The Inland Empire is a rather big, I do not know the exact counties, but I know it's Riverside County. It includes San Bernardino. It includes Victorville, the high desert. It includes, I'm just thinking about cities right now, but Highland, San Bernardino, Yucaipa, Colton, I'm trying to think of other words. I said Victorville, but I mean, it's a really rather large area that we service here in the Inland Empire and in Southern California. I think it might be, if it's not the biggest, one of the biggest counties in California. So we are rather expansive, which is why you have to email me specifically to find out what resource we have available in a specific county or area.
Amanda, can you speak to your apprenticeship program? I have a feeling that we have students participating today who may be eligible, may even be interested in that resource and may not know how they can take advantage of it.
No, absolutely. If you are interested in the program, go ahead and email me, and I'll go ahead and put my email in the chat so everyone has it. I'm sorry, it's reach out, not ratch out. And so the apprenticeship program, again, is it's a more specialized community health worker program. Okay, there you go. Correct email address. Is a more specialized program here that we offer at Reach Out and IHPC. So it's for individuals who, again, are either they're currently working in the field as a community health worker, or they already have an established internship. And these sites also have to have, they're being actively supervised throughout their training or job. And so we partner up with them and we provide this curriculum to, again, fine-tune their skills and provide them with even more competencies. So to make them more specialized, and it is a certificate that we offer, and we are partnered with Victor Valley Community College with that.
Wonderful, wonderful. Are there any other questions from our students or our educators? I have one more question. Some of our students may not have heard of any examples of students working their way through medical school or actually taking, going certain pathways on their way to becoming, say, a doctor, maybe working as a nurse first or an assistant. Can you speak to that a little bit?
Speak to about individuals who I'm kind of lost about your question.
Yeah, can you speak to some of the ways that students have accomplished or achieved their medical degree, maybe going through community college, or maybe working as a medical assistant first, or a nurse or a radiologic technician? Just some non-traditional ways that they've achieved their doctorate.
No, absolutely. I think a lot of the times when we think about becoming a doctor or a lawyer, things like that, we kind of think it's a linear path, right? That's how, you get there, you do all these steps, and then you're there. And if you miss one step, then you're completely out of the game. That is completely false. There are an abundant amount of medical professionals out there that this could be their second career. Or as Michael was saying, that it took them a little longer to get there because medical school, yes, it can be expensive. And some people, they either don't want to take out the loans and would rather pay for it out of pocket, or their loans only cover a portion of it. So yes, absolutely. We have individuals who work and take a little bit longer to get there, but it's not necessarily about the destination, but the journey. And we know that we're eventually going to get there. So yeah, we have had individuals, medical professionals who don't take the traditional route. This is not too far off from the traditional route, but for example, I have a sister and she's a physician, and I know that it took her a little longer, I believe, to get out to receive her bachelor's degree. And she took a year to do a public health or some type of health certificate. And then she became a doctor. But before she graduated with her MD, she also did a master's in public health. And now she is a doctor. So it's taken her a little bit longer than a traditional, medical professional would. But, life happens and there's lots of stops along the way. The important thing is, you have a passion and a drive, and you keep going for it.
I think we have a question, Mr. Barr.
No, I just wanted to make a comment that when I went through nursing school, I had quite a few other students with me that had gone from high school to a nurse's aide program, let's say through ROP, they got their nurse's aide, and then they were working. The good thing about working in a hospital, you could work any shift and be able to still do your schooling. And most hospitals are very accommodating to a student nurse schedule. So they did their nurse's aide, they were still getting income. If they had children, they were able to care for their kids and then start going to, let's say, an LVM program or to get into an RM program. So there's a lot of ways that you can achieve your goal. It may not be as easy as, you know, someone with children to be able to say, okay, I'm stopping motherhood, I'm going to school. You have to sort of take with what's coming your way, but eventually you could reach that goal if you get started. You know, if that's what you want, start researching, doing goals, and going for it.
No, absolutely. And you make an excellent point, Maria, is that for nurses, I've had friends too that they started and did their, their 2-year nursing program, and then they worked as like an LVN or a CVN, and then they went on to become a registered nurse. And then even on to becoming a nurse practitioner after getting and gaining that experience in the field. So it's not always a straight shot. And you bring up an excellent point as well. So for example, the military also provides you with skills and training to go into health careers and professions. And then even after you get out of the military, they provide you with some type of, I think it's a GI Bill to pay for education. But you already have some experience in the field. And that's not, the only way to go. There are lots of different ways and different routes. But going through the military is one, going for, if you want your goals to be an RN or a nurse practitioner, starting, from the very bottom is fine, and working your way up. That's definitely a way to do it, and get experience along the way to see if, hey, do I actually like this job? Because sometimes we get into the career and we're like, oh my God, I hate this. And you realize I don't like people, I don't like blood, this isn't for me. And getting that experience in the field, and that's something that I always will promote to students, is get some experience, whatever that is, talking to a professional to know what it's really like in that job, and find out, hey, what's your story? Because you'll find out that most people, or a lot of people, their journey is not linear at all. Mine wasn't.
Well, we just want to thank you, Amanda, and the Reach Out team for connecting with our educators and students today. This will conclude our session, but we want to make sure that educators and students all around the IE know that this is Health Professions Week, and that you can look up our upcoming sessions this week on sbcalliance.org. Again, sbcalliance.org. This has been a wonderful presentation. Thank you so much. Amanda, you have a great day.
Thank you. And thank you all for joining me today.
Wonderful. Thank you.